we are working as fast as we can to get people to have both jabs. It's very important, and thankfully the uptake is very high. But the second thing is that we monitor these new variants really, really carefully to check the effectiveness of the vaccines against them. Now, thankfully, the effectiveness of the vaccines against the variant first identified in India that you mentioned, after 2 jabs, does appear to be effectively the same as against the old B117 or the Kent variant, as it was called. And that means that we can have confidence in the strategy that we have and the strategy that has been working.
And the good news from the report which Public Health England published at the weekend was that actually we're seeing very, very strong vaccine effectiveness after the second dose for both the vaccines. Now, it's around 80 to 90% for the Pfizer. It's a little bit lower perhaps than against the Kent variant. And at the moment, the data suggests that the AstraZeneca one might be a little bit lower than, again, against the Kent variant, around 60%. But it's really important that those studies, they're quite early ones, with quite wide confidence levels, so high degrees of uncertainty. And as we go forward with more cases and more numbers, they will become clearer. And we're already starting to see a signal that the AstraZeneca effectiveness is rising in the second dose.
And the truth in this situation is that because we didn't have the testing capacity, it wasn't possible until we built that capacity to put the testing in place. And we were dealing with an unprecedented situation, as you know. And that is one of the things that that I will always look back on, which is that we worked incredibly hard to put in place what is needed to fight a pandemic. And thankfully now, over the last few months, we've really got these things in place. The over 1 million tests a day on a regular basis, and of course, the vaccine, which we've been working on since the start. The latest data show that the number of cases of coronavirus are rising. Yesterday, we saw 3,542 new cases, the highest since the 12th of April. The variant first identified in India, so-called B1617.2, is still spreading. And the latest estimates are that more than half, and potentially as many as 3/4 of all new cases are now of this variant. Now, as we set out our roadmap, we always expected cases to rise. We must remain vigilant. The aim, of course, is to break the link to hospitalizations and deaths so that cases alone no longer require stringent restrictions on people's lives. The critical thing to watch is the link from the number of cases to how many people end up in hospital. The increase in cases remains focused in hotspots, and we're doing all we can to tackle this variant wherever it flares up. Over the past 6 months, we now have built a huge testing capacity at our disposal,